And I'll just place the treatment head behind you. So I'm going to ask you just to bring your chin up a little bit because I'm on the sideways.
I had an MRI that showed a number of strokes, a lot of mini strokes. I'd had concussions in my early 20s, late teens, and at about 60-some, I lost my memory and I couldn't work, and I lost my vocabulary. When I used to speak contemporaneously without any problem, I couldn't put together 2 or 3 sentences, much less argue in court, much less think fast enough to make an objection. So I was done.
That's better, thank you.
And you can lean back and relax.
Great. I was in a motor vehicle accident and had a concussion and whiplash, and I was dealing with the aftermath of that. I was having a lot of difficulty, and my naturopath called me up and said, I think I may have found something.
This year we'll be treating probably close to 250 cases of some type of concussion. So you learn very rapidly, and I have a good team.
Now, what other areas, perhaps you're part of your daily routine, that you find you are improving, you're gaining something on that side?
My balance. I'm able to walk my dogs a little bit now, whereas before I was very afraid of falling down. My speech was terrible. I was having a lot of problem trying to find words, and sleeping, I'd get an hour or 2 and then I'd be up.
And what exactly did happen to you?
I was wrestling at school in a tournament, and I took a knee to the right side of my face.
A 15-year-old high school student, his coach noticed some of the symptoms of concussion. What are the main symptoms that you experience at this time? Stuttering, severe headaches, and very high sensitivity, painful sensitivity to the light. So we have initiated the course with a laser treatment, and after his treatment number 3, this young man stopped stuttering. He started reading books and was able to take off his sunglasses.
With his extraordinary energy, he replaced 4 other surgeons at
The young people may have had a concussion as recently as a week ago, but they've been out of school, they're swallowing aspirins or other analgesics, and they're dysfunctional and may even occasionally have seizures. And the parents are very vigilant today, and they bring them out. And it's dramatic how rapidly they respond.
In your own words, please tell me, how does it feel? It took us in total 15 treatment sessions to discharge him from our care.
feels a lot better, no longer stuttering.
He was back to normal life, normal daily activities, back to school, normal communication. So it's comfortable, not too tight?
No, it's not too tight at all. Yeah, I tried the traditional intervention through a university hospital in the Washington, D.C. area, and they basically said there wasn't anything they could do. My brain had become very noisy, and I couldn't think. I tried to have a thought, and I'd start that thought, and before I ended that thought, maybe a thought as long as 1 sentence, I'd lose the front end. And here I could sit, and all of a sudden the brain wasn't noisy anymore. I wept. It was astounding. I don't know any other way to put it. I mean, I just relaxed, and my mind was quiet for the first time in years.